Heel pain from plantar fasciitis can heal 100% if you focus on doing exercises that address the root problem. Sadly, most treatments done by healthcare professionals are addressing the symptoms rather than the root problem, so patients usually take much longer to heal if they heal at all. In this video, I'm going to show you the top 6 exercises for healing the root problem of plantar fasciitis. The first exercise is getting full toe mobility. So to do this, all you have to do is take off your shoes. You can be barefoot or in socks, and you're going to curl your toes up and down, and go 20 to 30 reps. Up and down is 1, 2, 3, just like that. And you could do both feet at the same time if you liked. And the whole point of this is to get all the joints in your feet to move. Of course, you're getting your toes to move because that's the part of your foot that moves the most. But while you're moving your toes up and down, you're also moving the bones in the middle of your foot and even some of the heel bones. And this is even better if you move your ankles up when you move your toes up, and then you push your ankle down like you're stepping on a gas pedal when you move your toes down. So just to get it all the way up and down to begin to loosen the joints in your feet. Doing this exercise prepares you for what's coming next, for the next exercises, so that you can begin to get stronger and better support your arches in your feet, which takes pressure off of your plantar fascia. Now, just a quick side note is if your symptoms are very severe, you may need to be doing a different kind of treatment right now. This is for when it's become under control or you're starting to really focus on the exercise of it. If your symptoms are very severe, you might need to talk to a doctor about getting pain medications or maybe orthotics, the things you slip inside your shoes, the insoles. You might even need to get on crutches or a cane to offload your leg. You need to make sure that you take care of the urgent pain. This is not fixing the urgent pain. We're trying to get the root problem addressed using these exercises. Exercise number 2 is doing toe curls, but with overpressure to make sure that you can curl your toes through their full range of motion. Now that you've been practicing moving your toes up and down, curling your toes like this with your hand over, make sure that you're moving your toes through the full range of motion, because what people often find out is when they put their hand pressure onto their toes can actually bend farther with the hand pressure than if they just try to curl their toes on their own. That means that you have a muscle weakness and your muscles aren't able to take your toes to the full range of motion. So you need to be giving your foot some overpressure, your toes overpressure like this, in order to train your muscles to work at that end range. Holding this for 10 seconds at a time and doing this for about 10 reps every hour, as long as you can tolerate it, as long as it's not making anything worse. Stop if it hurts or if you just don't feel it's right for you. Find the right amount of exercise you can do to get your toes to go through their full range of motion and for your muscles to get stronger in that range of motion. The holding is also important because it starts to wake up every single cell in the muscles that curl your toes, and you need all those cells to work in order to take that pressure off your plantar fascia. And if you don't do the holds, if you just wiggle your toes up and down like we did in the first exercise, that does begin to wake up the muscle cells, but you'll only use the muscle cells needed to quickly move up and down. If you hold it, you start to wake up the more dormant muscle cells and begin to use your muscles in your feet much more efficiently. Alternatively, you can use the floor to bend your toes. So it looks like this. You're just going to put your toes folded under your foot, and you can control how much pressure you're giving by adding or taking away pressure with your leg. Hold it there for 10 seconds and just try to make sure that you get all the toes evenly so that they all bend. You can do both feet at the same time if you like, and you would do this the same frequency as the other exercise. You want to do 10-second holds for about 10 reps, and you could be doing this hourly as long as your body is okay with it. The way you know that you're ready to move on to the next exercise is when you can curl your toes without your hands giving it any assistance, and you can make these parts of your knuckles, you have knuckles in your feet right here, pop up a bit. You see how the big knuckle right here pops up pretty well? As long as you can get these down here to start to bend better, then you're ready to go into this next exercise. The next exercise is heel raises. Now you have to be able to grab your toes by flattening them out. You don't want to curl them under your foot. You want to just put some pressure through your toe tips because that activates those toe flexor muscles. Then once you have that going on both feet, go ahead and raise your heels all the way up and then slowly come down, trying to maintain a little bit of pressure through your toes, through the tips of your toes. Only go about 10 reps. If you can't do 10 reps, do 3 or 4, whatever you feel like you can do. But you need to make sure that you go up maximally. You have to try to get your heels as high as you possibly can each time you come up, and avoid continuing. If you feel like you want to continue doing more, but you're no longer able to grab with your toes, you need to stop. That's a stopping point. The goal here would be to achieve somewhere in the range of 50 to 100 reps with breaks. You can do 5 sets of 10 or 10 sets of 10 or sets of 20, whatever you feel is appropriate for you. But doing that many reps really works to strengthen your toe muscles and take pressure off your plantar fascia. Now, if you're still having plantar fasciitis pain as you're doing this, you're not ready for this. You need to stick to the other previous exercises first. This is also an exercise that doesn't need to be done as frequently. This is a once a day, maybe twice a day. Some people do like to split it up and do 25 in the morning, 25 in the afternoon, whatever you feel comfortable doing, but it should not aggravate anything. If it is aggravating things, back off. You're just not ready. That plantar fascia needs to heal a bit more first. The fourth exercise is kind of an exercise, but also more of a posture. You have to think about your foot posture. What you're trying to do to take pressure off your plantar fascia is use the muscles of your foot to create an arch so that you're not putting so much pressure on the plantar fascia. Now that you've worked on grabbing with your toes and doing the heel raises, those toe muscles should be much stronger. So my friend Kay here's already doing it. She's pushing her toes down and increasing the height of her arch using her own foot muscles. This here is the absolute cure for plantar fasciitis. You have to get stronger at this. As long as you're doing this consistently, when you stand, you're going to be taking pressure off that plantar fascia all day long. So this should be the way you should stand. Inside your shoes, barefoot, however you are, you should be grabbing slightly with your toes. Now, we actually coached her up a bit before we started this, and she was overcorrecting. So go ahead and grab all the way. And you see how when she does that, the base of the big toe right here on both sides comes up? That's too hard. If you end up doing that, you're probably trying to grab 100%. You need to back off to like 50% or even 20, 25%, just so that you can keep the base of the big toe down right here, and you're only focusing on lifting the arches of your feet. When you stand and you're putting 50-50 body weight through each leg, you should be using the toes in both feet about equally. And if you start to lean one way, here's kind of where it turns into an exercise. If you lean over to the left here, then you should be grabbing slightly more with that left foot. That foot should do a little bit more work. And then when you go to the other side, now the toes on this foot are going to do a little bit more work. Practice standing like this at home. Practice standing like this when you're out at the grocery store or at an appointment or anywhere you're out. If you have to be standing, try to make that into a foot workout by grabbing with your toes and getting those foot and toe muscles stronger. Number 5 is learning how to walk while using your toes and your arch muscles, just like we practiced in standing. So remember, you're holding the toes of both feet engaged or activated whenever you're just standing. But when you're going to take a step, go ahead and take a step. The foot that you're leaning onto, the toes on that foot are the ones that need to grab for that moment that you're putting weight on your leg. And then when you take the next step, that foot's going to relax as you take the pressure off of it. Now you're putting pressure on this foot. Now the toes and arch need to engage on this side. So as you're walking, go ahead and walk more normal now. Every step you take, you need to be activating your toes and elevating your arches so that you take pressure off your plantar fascia and allow it to remain unirritated throughout the day. Now you can make a walk out in the park or a walk through the mall or anywhere, or walk around the block, an exercise. You just need to make sure that you don't do this so much that it starts to irritate your plantar fasciitis. Your tolerance right now in your plantar fascia might be that you can only be on your feet for 10 minutes or 20 minutes before it starts to get worse. That's all you should work in. If you feel like you can tolerate 20 minutes, 30 minutes or longer, then go ahead and pursue that, because it's going to add more strength to your toe muscles, and it's also going to train your plantar fascia to take more, but you may be so irritated that you can't do that much right now. Number 6 exercise to help you heal your plantar fasciitis root problem is a strengthening exercise. We talked about walking and standing. Now this one's going to really push your strength even more. We're going to do jumping with toe grabs. So you make sure you stand somewhere where you can hold on to something sturdy. She's holding onto the wall up top. Hold on to the counter, to a sturdy piece of furniture like a couch, a wall, something that you can definitely hold on to keep your balance. Then keep your feet a comfortable distance apart, and you're going to start with a little toe grab, just like we've been practicing. Then what you're going to do is jump up very slightly, like you're going to do a heel raise but with a bit more force, and you're just going to do about 5 to 10 reps like that. Go ahead. And every time you land, you have to land with a toe grab. So you're trying to maintain the toe grab every time your foot hits the ground. Now, some people will do these at a faster pace, like if you're jumping rope, you don't need to go that fast. You can if you want. All I need to make sure that you're doing in order for you to protect your plantar fasciitis problem for the long term, so you're not having an issue with it, is you need to make sure that you use those toes every single time you land on your feet. Work your way up to getting in the 50 to 100 rep range. You could do sets of 5, sets of 10 or 20, whatever you feel comfortable with. It should never hurt your plantar fascia more. It shouldn't make your symptoms worse the next day. It should just feel like you get tired without irritating anything. Now you have to figure out which of these exercises you need to be doing. You may not do all of them. You may pick 1 or 2 to work on and then progress into the harder exercises. Or it may be the case that you're ready for the harder exercises right now. And for some people, they never even need to progress to the jumping exercises to get relief from plantar fasciitis. I definitely recommend that the toe curling exercise at the beginning and the ones where you're moving up and down and where you're holding with overpressure, those typically need to be done more frequently, like every hour in some cases, as long as you can tolerate it without getting any worse. But once you get to the heel raises and the jumping, those are exercises you typically do once a day for 50 to 100 reps as you work up to that. But the walking and the standing, those are definitely lifelong things that you need to just learn how to do the rest of your life so that you can use your toe muscles properly and never have to deal with a plantar fasciitis problem on a recurring basis, every 6 months, every year, every 2 years. Hey, if you tried these exercises out and they began to help you out, drop a comment below and let us know how it went for you. Thanks so much for watching. Give us a thumbs up if you like this video. Share this with somebody you think needs to see this. And don't forget to subscribe and hit that notification bell so that you don't miss out on any of our helpful videos. I'll see you in the next video. Bye-bye.